All right. Thank you, everyone. And thank you for inviting me to the Sechelt Foundation group. Thank you so much. So as Jane has said, my name is CJ Butcher. In a previous life, I worked as an emergency nurse. And since then, I've also been working in rural and remote hospitals, so also including Prince Rupert. For anyone who knows where that is, further up north, it's not Prince George. Different services and different resources. And so I think it's excellent in terms of just looking at the resources that we have here within Sechelt for if you or a loved one is experiencing any symptoms or signs of a stroke. So my slides today have been adapted from Marie-Ève Legrand, who's our stroke systems redesign specialist here in Vancouver Coastal Health. So I just wanted to give a description of all the rural and remote communities within Vancouver Coastal Health and just identify what do we have here on the Sunshine Coast that's available if you or your loved one is experiencing any signs or symptoms of a stroke. So really quickly, just looking at Vancouver General Hospital, and Dr. Wood gave an excellent speech on some of the resources that are very quickly available to folks who are living on the Sunshine Coast. We do have access to the helicopter, the Medivac. So I don't know if you've heard it or seen it. That helicopter comes quite frequently. The helipad is right outside my office. So I get to hear it all the time, but it's good because it tells me that folks who need the treatment here on the coast can have quick access to both VGH and Lionsgate. So if you or your loved one is experiencing any stroke symptoms, once we go through the process as the two lovely ladies have just spoken about, and we can diagnose quickly that your family member is having a stroke, we can get you to where you need to be in order to treat you as fast as possible. And also not just around how we navigate you to the sites of VGH or Lionsgate, which is our primary feeder sites, but also how we communicate with each other. So I'll talk a little bit about how we AI diagnose strokes in a little bit. But just to note, there is a network within Vancouver Coastal Health that is available here serving you on the coast. And it's not just that we need Dr. Wood here, but we can connect with Dr. Wood and all the other folks in VGH and Lionsgate in order to get you the care as fast as possible. Excellent. Perfect. And part of that team, and as we've already talked about in terms of diagnostic imaging, there's also a great team here in terms of your emergency room physician, nurses, and allied health such as SLP, OTPT, helping you with that support after you've had the intervention or after you've had treatment. This is an amazing group of folks that help support you throughout the journey. So a big kudos to everybody who goes along this journey with you. Two new things that have happened in the last 6 months since I've been here. First of all, at Sechelt Hospital, we've started the hospitalist program. So that's a dedicated group of physicians that work within the hospital that support you throughout your journey. So before, if you were unattached, it was really difficult to find a physician that would follow you throughout. We now have a team that starts on the weekend and follows you every week as you go through your healthcare journey and help support you through your discharge. The other thing is that Lionsgate Hospital has worked in conjunction with us for anyone who is experiencing stroke and stroke symptoms in terms of referrals for rehabilitation. So they have a little bit more of a dedicated team in terms of the rehabilitation services. And so we've partnered with them that we can make a referral in order to send you or your loved one over to Lionsgate, and they can give you that intense rehab experience and then bring you back home once you finish that program and then be admitted to our hospitalist program. So it's a good way that we're integrating with our friends throughout the coast. And now I'm going to do some data dump here. So looking at our stroke volumes, so I just wanted to pull some of the data on what's actually happening here on the Sunshine Coast and within Sechelt. So as you can see, we usually hover around the same amount, roughly the same amount of strokes across year by year. I haven't updated this slide in terms of this year. But as you can see, a lot more ischemic strokes. So that is something that we can do something about, whether it's treating with thrombolytics or whether we're doing procedures to get rid of the clot manually that's happened over at VGH. I think that was all I had for that one. The next slide over, I don't want anybody to get too fearful, but we do look at how many patients do pass who do come into the hospital. We try our best to make sure that everyone is well cared for and that we do have good treatment options for. Unfortunately, people do pass. Sometimes it's because of said stroke. or TIA, and sometimes it's because of other complicating factors. The other piece along in this slide also shows that you might notice that the thrombolysis is quite low. That's because that speaks to our ability to actually get you to VGH in order to remove the clot mechanically versus having it going through the clot buster treatment that we have within the emergency department, which we can do, but is much more effective to send to VGH. And usually that allows us our window to expand greater. So we can do the clot busters usually within 4 to 5 hours, but after that we usually choose to send you over to VGH for mechanical extraction. And that can usually be done within 6 to 24. Our length of stay is quite low and meets provincial standards, which is excellent. And then also, I think just looking at the number of how many people are receiving CTs, MRIs, as well as the percentage of ischemic and TIA patients that are prescribed the antithrombotics after their discharge just speaks to the volumes of professionalism and just a really strong medical team that's here to make sure that you're supported, not just while you're in hospital, but also after your journey with us. Next slide. So what does that journey look like? So I'm just going to steal a bit from the previous presentation, but maybe add a little bit too. So the minute you call the ambulance, that call also notifies our hospital as well. So EHS, so the ambulance system, usually gets a phone call that you've made. They then look and diagnose where they need to go and what they need to treat. So we do have an auto launch program here. So if there's any trauma or anything where the paramedics feel that, we would be better served at VGH, they will automatically call the helicopter, and the helicopter will be here. They will meet the ambulance, and you will be auto launched to VGH. The other thing that we have is what we call the red phone in the emergency department, which is basically we feel like we have a hot stroke coming in. That automatically activates our emergency room physician as well as our medical imaging folks to know, please hold the CT scanner for the moment because we have somebody coming in, so that we can get that door to assessment piece immediately. So you should be coming through the door and going straight to CT as fast as possible. The other piece in that equation is looking at the emergency room physician. Once we have that CT scanner, and as we start to use our equipment and create those communication pathways, the emergency room physician can create a plan and also work with the stroke teams, both at Lionsgate and VGH, using our AI technology, so we can quickly diagnose what kind of stroke it is, what kind of treatment it is, and we can get right into that treatment plan as soon as possible, so we're not waiting for anything. And once that decision is made, we can decide whether we're going to transport you out via the helicopter if the auto launch hasn't started, or what are we going to do if we're going to thrombolyze within the Sechelt Hospital. So there's a variety of options that we have within the hospital, which is something that I find is unique to this hospital, is we do have a lot of services and resources on the Sunshine Coast and quick access to VGH and Lionsgate. That's something that I haven't seen in a lot of small hospitals, but it's excellent. And I think it speaks to just the integration of care and how we've planned what we're doing. My last slide here is the after journey. So after we've done the treatment, after we've thrombolyzed, after we've mechanically removed the clot, then what? So everyone's journey is different. Treatment is different, and how PT, OT work with you is different. So I'm not going to say that everything is cookie cutter, but the team definitely starts on day one to start working with you to kind of build up that strength and start to make a plan with you in terms of where's our goals of care and where is your goal, so that we're matching that up and then continuously checking in with you to make sure that your treatment or your progression is where you need it to be. Once you're planning on being discharged or going home, occupational therapy will work with you to kind of assess your home, see what mobility aids you need when you go home, or if you need any mobility aids, or if you need any assistance in the home, and home care and home support can support you once you go there, and that's part of our community team. So I just wanted to say a quick thank you to everybody, and it's amazing work that's happening within VGH and especially within the new cardiac center over there. And so just to let everybody know, we do have access to that, even though they're not here. We have quick access, and we can get you over there pretty fast. Thank you so much.